Today's topic is dissociation and dissociative disorders. What exactly are they, and how do I go about doing so? Now, I know that many of you have struggled with this or know someone who has. Many of you have had recurring dissociative issues in the past, some of you have only had one episode, and many of you are wondering what the heck that is. Why do I feel wise? Do I forget what's going on? We get all stressed out because it can feel very uncomfortable. So there are a variety of dissociative disorders, and if you're interested, you can look them up online under the DSM, but I decided that for this video, I wouldn't read from the DSM because diagnosis isn't as important to me as understanding what's going on for you. That makes sense. So dissociation is most commonly caused by a psychological trauma, which could be anything. Many of my friends who struggle with this have been sexually or physically abused in the past. Many of them have come from alcoholic or drug-abusing homes, and it can be because of all of the psychological stress and trauma that's going on in our mind, and it's quite clever to be honest. Our minds, I don't know, they want to protect us and keep us safe, right? So, whether we self-harm, have depression, anxiety, or an eating disorder, whatever it is, that's our mind's way of coping, and dissociation is just another way to cope. So if all of that stuff is going on, and we're like a teapot right in, we're steaming, we're about to blow, we're so overwhelmed it just floats us out of our head and we don't even know what's going on, we don't remember that time. And many of you will say it felt like you woke up, but you weren't sleeping, and then you're back where you were, which can be really freaky and scary. But it's really our mind's way of assisting us in taking a break because everything is emotionally and psychologically overwhelming. So that's what dissociation is, and it's normal to feel like you're watching yourself, or to feel numb from an out-of-body experience. It's normal for some people to experience tingling sensations in their fingers and feet, almost as if their feet and hands are falling asleep. It is normal to feel extremely cold, and many clients report getting chills and feeling extremely cool when this occurs. It's normal, as I mentioned, to not remember and to feel as if you just woke up. So don't think you're crazy because what's happening to you is a normal reaction to dissociation. That's what happened to me. Oh my God, oh my God, oh my God. I do, and there are many things we can do, so don't worry. The first being talk therapy, like I'm seeing my clients, like I talk to you, like talk to each other, and the main goal for talk therapy when we're talking about dissociation is to help us feel empowered over our emotions and the experiences that caused those emotions. So, with my friends, and I know this sounds terrible and you're thinking, I hate this, I never want to do this, I'm going to go over all the details of what happened. So any trauma you've experienced or something we believe is causing your dissociation. We'll try to figure out what that is, and then we'll talk about it in detail, and we'll try to keep you here as we do so, because the more we talk about all those little nitty-gritty details, the easier it will be for us to close the book on it and move on, and things will come up, and we won't dissociate anymore because we are empowered. We have control over how we react to those oceans, and we have coping skills, outlets, and ways to express ourselves so that we don't feel overwhelmed. So talk therapy is an option, but please try to find a therapist who is kind, gentle, and patient, and who has a trauma background. Whether they specialize in trauma or are a CBT therapist, CBT therapy ties in really well with treatment goals and treatment planning for coping with dissociation, so those are the things I would look into. If you have that luxury, which I know some of you don't, that's fine, but keep that in mind and make sure they can work with you long term because a lot of this takes time, which is fine. The second thing we can do, as I've mentioned to many of you, is use our 5 senses to bring us back. Smell something that has a strong odor. It could be anything from stinky blue cheese to I'm not sure what smells strong. Even orange juice is difficult to come up with on the spur of the moment. Something that you like is a smell that you can smell right away and associate with something good. We can poke or run our hand into something sharp or powerful. Don't use this as a means of self-harm, but doing so can be extremely beneficial. What am I feeling as well? I feel soft, a hard chair, a pokey microphone, and what do you feel on your body as you go through that? So use those senses to guide you back. And in my experience, those are the simplest and best things to use. As well as reaching out if there's anyone we can call me like a freakin' now I need to vent, but I find that using your 5 senses to ground yourself and breathing techniques are the best in the moment. Think about those things because dissociation is something our minds do to protect us. One of my patients actually squeezes ice in her hand and that really helps, so think about those things because dissociation is something our minds do to protect us. It's a protective mechanism. It's our body's way of saying, hey, whoa, there's too much going on. I'm at a loss for what to do, so it kicks us out. However, be aware that this is a normal reaction. It's protective, and there are ways to work through it and get past it, we just have to fight for them. I know I'm always telling you to do it, but that's how our community grows and those are the ways we help one another, through our experience, and I'd really appreciate it if you'd share the tips and techniques that have worked to keep you grounded. What grounding techniques work best for you? I'm just sharing my experience, but everyone's is different. Thank you for watching this video, keep striving for a healthy mind and body.